Hi, good evening, friends. This is Colonel Pradeep Pendyala, your buddy once again, the professor of anesthesiology at Asram Medical College, Eluru city of Andhra Pradesh, India. Friends, as I have promised you earlier, I'll be getting you something very special in the medical field. Today, one of the most important topics I'm going to discuss, none other than a myocardial infarction, commonly known as heart attack, occurs when blood flow decreases or stops to a part of the heart, causing damage to the heart muscle. The most common symptom is chest pain, discomfort which may travel into your shoulder, arm, back, or neck or jaw. Often it occurs in the center or left side of the chest and lasts for more than few minutes. The discomfort may occasionally feel like heartburn. Other symptoms may include shortness of breath, nausea, feeling faint, a cold sweat, or feeling tired. About 30% of people have atypical symptoms. Women more often present without chest pain and instead have neck pain, arm pain, or feel tired. Among those who are above 75 years, around 5% have MI with little or no history of symptoms. An MI or myocardial infarction may cause heart failure, irregular heartbeat, cardiogenic shock, or a cardiac arrest. This is one of the most important topics to be discussed to anyone and everyone. Most MIs, I just remind you again, myocardial infarction, occur due to coronary artery disease. Risk factors include high blood pressure, smoking, diabetes, lack of exercise, obesity, high blood cholesterol, poor diet, and excessive alcohol intake. The complete blockage of a coronary artery caused by a rupture of an atherosclerotic plaque is usually the underlying mechanism of an MI, myocardial infarction. MIs are less commonly caused by coronary artery spasms, which may be due to cocaine, significant emotional stress, commonly known as Takotsubo syndrome or broken heart syndrome, and extreme cold, among others. A number of tests are useful to help with the diagnosis of MI, including ECG, electrocardiogram, blood tests, and coronary angiography. An ECG, which is recording of the heart's electrical activity, may confirm an ST elevation MI, otherwise known as STE MI. If ST elevation is present, commonly used blood tests include troponin and less often creatine kinase MB. Now, what is the treatment? Treatment of an MI is time critical. Aspirin is an appropriate immediate treatment. Aspirin for a suspected MI. Nitroglycerin or opioids may be used to help with chest pain. However, they do not improve overall outcome. Supplemental oxygen is recommended in those with low oxygen levels or shortness of breath. In a STEMI, treatments attempt to restore blood flow to the heart and include percutaneous coronary intervention, usually known as PCI, where the arteries are pushed open and may be stented. I'm sure you have heard about stents. Or they could be thrombolysis. Thrombolysis, where the blockage is removed using medications. Thrombolytic agent. People who have a non-ST elevation myocardial infarction, known as NSTEMI, are often managed with the blood thinner heparin, with the additional use of PCI in those at high risk. In people with blockages of multiple coronary arteries and also diabetes, the treatment is always coronary artery bypass surgery. You have heard a number of times CABG, bypass surgery. Coronary artery bypass surgery, CABG. That may be recommended rather than angioplasty when there are blockages of multiple coronary arteries with diabetes. After an MI, lifestyle modifications along with long-term treatment with aspirin, beta blockers and statins are typically recommended. Hope you have enjoyed and understood the most important subject in the medical field, that is myocardial infarction. Thanks for patient listening. More in my next brief lecture. Until then, Colonel Pradeep would love to sign off. Take care. Bye-bye.